So in this video, we're going to talk about psychosocial integrity, psych NCLEX mental health. This is part 2, 10 high-yield questions that will show up on your NCLEX. Know them and you'll be golden. Are you ready? NCLEX practice test, 10 questions. Let's get to it. Like I said, these questions are difficult, but it's designed to teach you to be comfortable with this. As usual, read the question from the back. Which characteristics should the nurse anticipate? You have to underline the buzzword as you read the question. Characteristics, that means features associated with something. I don't know. It's a select or apply. I'm not going to pick everything. And this is assessing a 5-year-old child, okay? Suspected is having what? ADHD, right? Suspected of having attention deficit hyperactive disorder. This is your buzzword. What should I see? Difficulty remaining seated during activities, attention to details, maintaining prolonged attention on structured activities, prefer repetitive routines and limited social interaction, excessive talking. What do you think? Pay attention. Characteristics, all up, select or that apply, and then attention deficit hyperactive disorder. Pause the video, answer it on your own, and then see the way I'm going to approach it. I've given you the clue. I'm focusing on here. On all psychosocial integrity, go for the keyword attention deficit hyperactive disorder. Every question, attention deficit hyperactive disorder. Number 1, difficulty remaining seated during activity, attention deficit hyperactive disorder. This is good. Attention to details. The patient does not have attention to details. That's why we call it attention deficit. Wrong answer. It's a trap. Most people will pick that. Maintaining prolonged attention on structured activities. This is also a trap for you. I cannot maintain this. That's why I have attention deficit hyperactive disorder. Prefer repetitive routines and limited social interaction. Another what? Trap. They don't have repetition of routine and limited social interaction. They want to talk to people. That's why they are hyperactive. This is autistic patient. Excessive talking. They like talking. You can see 2 answers. If you were select, you get 0. But you got to base it on your buzzword and you'll be able to answer this question flawlessly. Which prescription should the nurse prioritize? Prioritization 101. This is B sharp. The most important that is going to kill the patient. And nurse is reviewing medication prescription for a client admitted with a suspected diagnosis of what? Alcohol withdrawal. Underline your buzzwords. Use them to answer the question. Alcohol withdrawal. I got to prioritize. Is it naloxone, flumaxinil, chlordiazepoxide, or thiamine? Then go back. Put it together. These are the key you should focus on. Alcohol withdrawal. What do I do? What should I prioritize? What is going to kill somebody in alcohol withdrawal? And then you pick your answer. If you're in alcohol withdrawal, the major problem is seizures. Which medication is going to help with seizures? Benzodiazepine. Do you see benzos? Naloxone is for opiate. Flumaxinil is for what? Overdose of benzos. I don't have benzos on board. This is a benzo. Thiamine is used for what? Alcohol withdrawal. It's not the prioritized medication to prevent seizures. Benzos is the best answer. Therefore, C is what you're going to pick. Which is the most therapeutic response by the nurse? Don't worry about it. There's an easy way to answer this. A client diagnosed with schizophrenia refused to take the prescribed medication. I don't want to take my medication. Everybody goes through this. Sometimes you will get over it. Is that therapeutic? Why you do not want to take this medication? Why? Question. It is your right to refuse the medication, but we are here to help you. Is that therapeutic? I will inform the physician to discharge you then. Hey, the nurse is mad. Which one will you pick? Pause and answer so that you can keep track of your record. I want you to get over 70%. At least 7 out of 10. I can tell you the best answer is this. This acknowledge autonomy. They acknowledge that the patient has his own power and he support the patient. But we are here to help you. Why is never a good answer. Everybody, I'm not everybody. I'm dealing with you alone. So you cannot generalize it. And then you're mad, you want to tell the doctor to send a patient home. No, it is your right to refuse medication, but we're here to help you. So you better take it. Which findings are consistent with the diagnosis? Select or apply. And this is assessing a 4-year-old child suspected of having autism spectrum disorder. They avoid eye contact during interaction. They repeat the same words or phrases frequently. They engage in repeated hand flapping movement. They easily initiate play with other children. They demonstrate advanced abstract reasoning skills. They show interest in social interaction. There's a bunch of buzzwords. Trap. This is why psychosocial integrity can be a little bit confusing. The words sound funny. The words sound the same. They are all distracting. They look normal, but they are not. Pay attention to the keyword. And the keyword in the question is autistic. What do you think autistic spectrum disorder look like? They avoid eye contact. That's classic. They repeat same words and phrases. Classic. If they repeat same words and phrases, they are going to have repetitive and flapping movement. They lack social interaction, so therefore they cannot initiate play with children. Therefore, F is wrong. Show interest in social interaction is wrong. You see how I connect them? This may be a trap. You think they can understand abstract reasoning, but not only concrete. Therefore, this is wrong. So there's only 3 answers over there. If you over select, you lose more points. So these are your right answer. Which factors should the nurse consider as possible contributor to this disorder? Select or apply. That means you got to find what is causing this. A nurse is assessing a client with primary insomnia. If you can't sleep, what should be the cause? Primary insomnia, that means we can't figure out what is the problem. Are you drinking a bunch of coffee during the day or late in the evening? Chronic stress and anxiety, consistent bedtime realization routine, persistent worry about sleep, quiet and dark sleeping environment. Think about it. Which of this can contribute to insomnia? Don't overthink about it. Look at the answer choice. Pick yours in the comment section. If you knew this is Adapt NCLEX, we're dealing with psychosocial integrity, very high yield topic. If you like this video, subscribe for more content. And if you're watching this video and you like it, just give me a thumbs up, and then so that we can grow the channel. And I'll give you a thumbs up. And just tell me where you're watching from. Excessive caffeine intake can cause that. You can't sleep. The caffeine withdrawal symptoms. When you stress, you can't think. If you go to bed at the same time and you relax, you're more likely to sleep. If you worry about going to sleep, yes. If the environment is quiet and dark, hey, you're going to fall asleep. Therefore, 3 are right and 2 are normal, right? This consistent is good. Stressed and worry about sleeping are bad. C and D, E are normal, and therefore they are not contributors. They help you sleep. They don't prevent you from sleeping. Which response by the nurse is most therapeutic? Therapeutic communication again. A nurse is caring for a client who was sexually assaulted and state, this is my fault. I should have fought harder. What you say to that patient, you should have prevented what happened. You blaming that patient? Why do you think you are blaming yourself? Why you asking why question? You did nothing wrong. The assault was not your fault. Acknowledging that it's not your fault. Many clients feel the same way after an assault. I'm not many clients. I'm one person. Therefore, the most therapeutic is to acknowledge the patient complaint and tell them you are there for them. This is not your fault. This action by the nurse is considered by what? An Alzheimer's client refuses to prescribe medication. Another Alzheimer's, I say, I'm not taking my medication. The nurse responds by saying, I will shove this in your mouth right now. What do you think the nurse has done? Assault, battery, negligence, and malpractice. Pick your answer in the comment section. But this is always a trap. Most students forget there is a way you can pick this answer choice easily and know what most people will pick. They're going to pick battery. That's wrong answer. So watch it for the NCLEX. If I'm not touching you, I'm using my words, I'm assaulting you. If I touch you, I'm bothering. If I did something against standard of care, negligence. And if it affects my practice, more practice. Therefore, this patient was assaulted. Which action by the nurse require intervention by the charge nurse? That means you're doing something wrong. And nurse is implementing the outpatient plan of care for a client being discharged after treatment of suicide. Patient has suicide ideation. Patient is going home. What do you implement at outpatient, not inpatient? Schedule a follow-up medical health appointment within a week. Do you think it's appropriate? Encourage family involvement and support after discharge. Provide a client with information about crisis hotline service, and assign a one-to-one sitter for outpatient monitoring. This is very important. You have suicide ideation. You're going home. What are we going to do? How are we going to help you so that you don't commit suicide? Pick your answer. Let me know. And question 8, I want everybody to put the answer. If you're watching it, let me know which Sancho choice you pick, because this is a trap. What do you think? Require intervention. You're doing something bad. If you schedule a follow-up, this is good. If you ask family to support, that's good. If you give them information where they can go if they're having issue crisis management centers, good. One-to-one is for inpatient, not outpatient. You cannot do that. It's not realistic. Therefore, this requires intervention. You sound good, but it's a wrong answer. Which actions indicate effective coping by the spouse? This is also a little bit difficult, right? But pay attention to the buzzword. It depends on what you're focusing on. And this is assessing the spouse. So the patient is now the spouse of a client recovering from substance dependence, right? The client as substance dependent, but now the spouse is what you worry about. The spouse has a history of codependence, a dependent behavior. Which action indicate effective coping by the spouse? The spouse is now has a diagnosis of codependent, and then we want to see if she's having coping issue or is effective. Attending a family support group regularly, setting consistent limits with the partner, frequent making excuses for the partner's substance use, assuming responsibility for the partner's missed obligation, monitoring the partner constantly to prevent relapse. Which one do you think indicates that I'm coping if I have codependent problem? Codependent is the spouse, not the actual patient. But in this question, the spouse is the patient. So if the spouse is doing this, do you think it's okay? Attending family support regularly, this is okay, effective. Setting consistent limit with the partner, yes, so that it doesn't overstep a behavior. That means she's basically taking charge. Frequently making excuse. If you make excuse for your partner who is abusing drug, you are not coping. That's the definition of codependent. You assume responsibility for what your partner did as codependent. You are not coping. You are monitoring the partner constantly to prevent relapse. That means you are too much dependent. You are not coping. Therefore, only A and B are your right answer. If you overpick, you lose a point. But this is a hard one. I know if you get it wrong, I want you to watch that portion again. Understand codependent and dependent, because they will confuse you with the patient. And the last one, NCLEX practice test, NCLEX practice question, NCLEX review question on what? Psych nursing, psychosocial integrity. What do you think? Which findings should the nurse anticipate when assessing a client with PTSD? Selected apply. A nurse has attended a staff education program about PTSD. Which one should you see? What are the features of PTSD? The answer choice is imposed after traumatic, and there's a stress, and there's a disorder. Recurrent nightmare of the event, amnesia to the details of the event, hypervigilance, flashback, lack of interest, emotional outburst. What do you think? What do you think? Recurrent nightmare, typical for that. Amnesia of the event, typical of that. Hypervigilance, typical of that. Flashback, this is typical. Lack of interest, typical. Emotional outburst. What does that mean? They're going to have emotional outbursts. They're very worried about what is going on. They start to have depressive symptoms, so lack of interest of the things. They're going to have flashback, relive the situation. In the process, they're going to be hypervigilant. When they hear a sound, they're jumping. That's hypervigilance. You try to forget, so amnesia of the event, and they have nightmares about the whole thing. How did you do? 10 out of 10. I hope so. But at least I want you to get over 70. Thank you for watching, and thank you for supporting the channel. It's a pleasure to be with you, and follow for more content like that. Take care of yourself. Bye.